We have a few more people who have joined in now. Hi Apurva, hi Divya, hi Ganesh. We'll just wait for 1 or 2 minutes more and then we'll start. Shweta, it's level 5. I think we can start and as and when people join in, we can let them in as well.
Yes, yes, yes. I think
Okay,
this is
perfect. Right.
so. People are
So,
joining in, and I am letting them in. You may start.
yes. So very good morning to everybody this Saturday morning. And I'm sure all of you all might have taken out some time from your busy schedule to attend this informative webinar. And I hope that this truly helps you. So the topic of today's webinar is to overcome insulin resistance in order to manage your hormonal issues with resilience. Why I say this is because whenever any patient or anybody has insulin resistance, it can lead to a lot of hormonal issues in the form of diabetes, PCOD that we'll talk about later. Therefore, if there are people who manage and overcome insulin resistance, automatically the hormonal issues become less debilitating.
Huh? Hi.
Can I request everybody else to stay on mute so that there's no background disturbance? Thank you. Okay. So as you can see in this image, now you will, some people might think what exactly is insulin. Insulin is actually a hormone, an endocrine hormone, which is released by a gland called as pancreas. As you can see in this figure, this is the pancreas, what you can see, which is zoomed in. And I'll just start my pointer. Yeah. Using the laser pointer, wherever I'm pointing it, you can see this is the pancreas. This is a zoomed in image of the pancreas. Technically, in the abdomen, in the stomach, you can see the location of the pancreas. It is surrounded by the stomach. It is surrounded by the intestines. Above is the liver. So it is surrounded by various organs. And the main function of the pancreas is to release some pancreatic enzymes which help in digestion, as well as it increases a very, very important hormone, which is called as insulin. Now, how is insulin released? Whenever we have a stimulus that raises the blood glucose levels, so basically when blood glucose levels will get raised is when you eat anything which has sugar, which has carbohydrates. That time the blood glucose levels will increase, and this high blood glucose level is going to be detected by the pancreas. Now, there are specific cells in the pancreas that help to release insulin, and these cells suddenly get stimulated. These cells then release insulin and send signals to the liver so that the glucose can be stored into glycogen, that is a storage form, and majority of the glucose will be taken up by the cells for utilization. Now, once this happens, then automatically there are signals sent to the pancreas which tell, okay, no more insulin, and the job of insulin is done. So now the hormonal levels, your glucose levels and insulin levels return to the normal, acceptable homeostatic levels. Homeostatic means which is normal for the body. Okay, so this is the entire loop of how insulin is released. Now let's come to how does insulin work. Insulin at cellular levels, I told you there is an uptake of glucose by various cells in our body so that they can utilize it for their survival. So what happens is when insulin is released, it binds to a specific receptor, which is called as the insulin receptor in the cell. And when this binds, the glucose channel opens and glucose enters into the cell and it is utilized by the cell. So insulin is like the key which binds to the receptor, which is like the lock. So imagine there is a lock and key. When you have to get into your house, you have to put the key into the lock, open it, and then you get the entry. In the similar way, glucose is like you. So once the lock and key bind appropriately, the key opens the lock, insulin binds over here, then glucose gets entry into the cell and can be utilized by the cell. So basically, if there is any problem in this lock and key mechanism, glucose will not be able to enter the cell and glucose will be there only in the blood, which will show as high blood sugar or high blood glucose. Okay, so this is a diagram which is again, it's a video which is showing, see, insulin is binding here, insulin binds and the channel for glucose entry opens. It happens very quickly in milliseconds of time. Insulin binds, glucose enters the cell. Now, what happens in insulin resistance? The word resistance itself has a meaning. So in insulin resistance, you have high insulin in parts of the body. For example, I told you there'll be more insulin in the blood, but less insulin in the cells because the cells are saying, no more insulin. I'm rejecting you because there is some difference in the conformation of the lock and key. The key is not able to bind properly to the receptor, to the lock. So the cells say, I'm rejecting you insulin, and therefore the glucose cannot enter the cells, and therefore there won't be a proper reception of glucose, proteins, and nutrients. Now with this, pancreas gets some feedback. So the pancreas receives the feedback that the cells are low on insulin. They are not using the insulin, so I'll send them more. Maybe there is some issue, maybe there's less insulin. So I'll send them more because the pancreas doesn't understand that the cell is only rejecting the insulin. Okay, so pancreas is sending more and more insulin. So this entire thing, this entire loop is called as insulin resistance. So basically, pancreas is going on releasing insulin, but the cells are not, allowing the utilization of insulin and the uptake of glucose because there is some problem in the lock and the key mechanism. Now, what are the causes for insulin resistance? There are several causes. The most important of these include genetic factors. So if somebody in the family has a history of insulin resistance, it can adversely affect and cause insulin resistance in the normal individual. Obesity and a sedentary lifestyle, very, very important cause. I think all of you all might have read a recent report that the rates of obesity are just rising and rising with each passing day, and things are just getting worse. So obesity and a sedentary lifestyle is also an important cause of insulin resistance. Similarly, aging. So as we age, again, the lock and key conformation changes and there is more susceptibility to insulin resistance. Some medications, for example, steroid medication, some of the immunomodulatory drugs, some of the antipsychotic medications, all these can also lead to insulin resistance. There can be some rare disorders which can cause insulin resistance. For example, one of which is called as partial lipodystrophy. So don't get into the technical terms. It just means that there is wrong deposition of fat. It's unequivocal. Some areas such as the abdomen and the central part has more fat and there is less fat in the extremities, in the hands and the legs. So that is one rare disorder also which can lead to insulin resistance. Okay, now insulin resistance occurs. You might say, so what? Insulin resistance is there, so what? Well, it can lead to a lot of issues. Therefore, it cannot be a so what because insulin resistance can lead to type 2 diabetes mellitus, hypertension, which is raised blood pressure, dyslipidemia, in which your cholesterol levels go haywire, especially there is an decrease in the good cholesterol, which we call HDL cholesterol, and an increase in the bad cholesterol, which is the LDL cholesterol. So that is the most important feature of dyslipidemia due to insulin resistance. Then there can be atherosclerosis. Atherosclerosis over here would mean cholesterol deposits, triglyceride deposits in the blood vessels, which will block the blood vessels. And therefore, it can lead to even cardiac complications. And then we have PCOS, which is polycystic ovarian syndrome, which is a very common hormonal imbalance disorder, which is seen in females in terms of the irregular menses, incorrect lifestyle. All these kind of features can occur, all these diseases can occur, disorders can occur due to insulin resistance. Okay, so this image just gives you a visual depiction of which organs are more commonly affected due to insulin resistance. So I told you the arteries can get affected because of cholesterol deficits. So atherosclerosis, blood pressure can increase. So there's an arrow pointing towards the heart. So if you have a visual depiction, the reception is better. Your brain will be able to register it better. Therefore, I have depicted in this slide that heart is affected. Blood pressure can increase. Cardiomyopathy, that means the heart can be slightly enlarged, the heart wall. All this can occur due to insulin resistance. Obesity. Now, obesity is a cause of insulin resistance, also an effect of insulin resistance. So it works both the ways. It works as a vicious cycle. One aggravates the other. Then there can be glucose intolerance. Type 2 diabetes mellitus. Type 2 is the adult form of diabetes mellitus, which is very common. Not the type 1, this is the type 2 diabetes mellitus. Then there can be liver involvement, which is seen in the form of fatty liver. Fatty liver is something you might have heard very commonly due to alcohol, but there are non-alcoholic causes of fatty liver, and insulin resistance is one such cause. Similarly, the brain, the central nervous system can also get affected and can lead to, forgetfulness in the form of Alzheimer's disease. It can predispose to even cancers. It can affect the functioning of kidneys also. And as I already told you, the female reproductive system can get affected if insulin resistance leads to PCOD or PCOS. While I speak, I may just request anybody from the audience, in case you have any queries, you just put it in the chat box while I'm speaking, in case you have any queries. We will get back to the queries, questions towards the end of the session. After the session, we will be having one more session, which will talk about the diet and nutrition, and we'll sort out the queries together. So this talks about how insulin resistance occurs and what it leads to. Now let's come to the symptoms of insulin resistance. So very common symptoms, very easy to understand. Acne is a very common symptom. Acne in the form of pimples. You might have heard of pimples. Yeah. So that is a very common symptom. Skin tags. I have an image in the further slide which will show you what exactly is skin tags. Increase in the belly fat, especially in the abdominal area, especially in the central abdomen, central stomach area. There would be more fat. High triglycerides, high cholesterol. I already told you the bad cholesterol, LDL cholesterol will increase. Triglycerides is also one such important contributing factor, which is seen in lipid profile, that increases the chances of cardiovascular complications. High blood sugar. I already told you it increases chances for diabetes, therefore high blood sugar. Fatigue or tiredness after meals. Weight gain. Gout, because there's an increase in uric acid levels also due to insulin resistance. So gout presents in the form of joint pain. Decreased male hormone, that is testosterone. Low muscle tone, because the muscles need glucose for energy, glucose for utilization. They are not getting that glucose. And therefore, we see that there is a decreased testosterone, low muscle tone. PCOS, I already told you about this. Fatty liver, craving for sweets. There will be more craving for sweets. Hair loss. Some cases, very rare cases, there could also be low blood sugar. So all these together are symptoms of insulin resistance. Okay, I'll just mention that it's not necessary that every patient of insulin resistance will have all of these symptoms. Maybe only one or two symptoms may be present, or maybe 5, 6 of these symptoms may be present. So it depends. It's variable from individual to individual. But it is a sign, an alarm for you to understand that now is the time to take charge. Now is the time to control and realize you have insulin resistance, so that you don't progress into the complications and the disorders that can occur due to insulin resistance. This is a very common feature in insulin resistance, that is dark velvety patches, especially at the back of the neck, as you can see in this image. In the armpits, so there are dark velvety patches. This feature is also called as acanthosis nigricans. You don't need to know the technical term, but just know there are dark velvety patches, a very, very common feature, very common symptom of insulin resistance. These are skin tags. So I had mentioned to you that skin tag is also a very common symptom of insulin resistance. So here you can see, as where I'm pointing my laser, these are all skin tags that were seen in a patient. Acne. I think some of you all are well versed with the meaning of acne. In layman's term, it is pimples. So acne is also a feature of insulin resistance. Although acne can occur due to many other causes, but you need to rule out insulin resistance in that case. Okay, now if insulin resistance is present and along with insulin resistance, there are several other issues such as hypertension, that is high blood pressure, obesity, and dyslipidemia. That means, low good cholesterol, high levels of bad cholesterol. All this together can lead to something called as metabolic syndrome. And in case the patient is diagnosed with metabolic syndrome, the chances of cardiovascular diseases, heart diseases, raise by many fold. So that is again a bad thing. Along with insulin resistance, if there are several other features associated that lead to metabolic syndrome. Not good for your heart, not good for your body. Okay, so here you can see what happens is how insulin resistance progresses into diabetes. First, there is insulin resistance. If people don't pay attention to it, ultimately it progresses into IGT, which is impaired glucose tolerance, then into impaired fasting glucose, and ultimately into diabetes, where the HbA1c levels would be raised. So it is a slow progression, and therefore it is time to take charge at this step itself. If you control things at the first step, IR, insulin resistance, you will not progress into the stage of diabetes. So don't wait for the worst to come. Pay heed to it, pay attention to the symptoms at a very early stage. Also, you see, as you progress into several stages, the chances of cardiovascular risk, cardiovascular diseases also increases. Heart health worsens as one progresses into every stage before diabetes. This is commonly referred to as a pre-diabetes stage, where there's insulin resistance, impaired glucose tolerance, impaired fasting glucose, but HbA1c levels are normal. In diabetes, most likely, even fasting glucose will be impaired, HbA1c levels will be raised. Even after meals, glucose, average glucose, everything will be raised. Okay, now this is a diagram which shows you, this is a figure which shows you initially when there's normal functioning, there is good levels of insulin production and normal levels of blood sugar. As one progresses into insulin resistance, which is also called as a pre-diabetes stage, what happens is the insulin production is increasing, and even though the blood sugar might not be that high, but as you move into type 2 diabetes, blood sugar is rising drastically, and that's the diagnosis of diabetes. Pay heed to it, because see, you can see in pre-diabetes, insulin resistance is increasing slowly, until it stabilizes completely in type 2 diabetes. And once type 2 diabetes sets in, there would be a decline in insulin, and therefore blood sugar will rise even further. Things get even worse. So take charge at the stage of insulin resistance, recognize it at the stage of pre-diabetes, so that you do not progress into type 2 diabetes mellitus. Okay. Now I have, kept this slide on purpose, because this slide talks about how to treat insulin resistance. So there was a study that was conducted, a clinical study, a clinical trial. You might have heard of clinical trials during COVID time. So that time, a study, similar to what was done in that time, a clinical trial, a clinical study was conducted in almost 530 participants, 530 people who had insulin resistance. Ultimately, the insulin resistance led them into metabolic syndrome, pre-diabetes, type 2 DM, and uncontrolled type 2 DM obesity. But with lifestyle modifications in terms of good sleep schedules, increased physical activity, good dietary patterns, and good amounts of exercise, 30 minutes per day, that led to very positive impact, very good impact in the blood reports of the patient. So what was seen is there was a decrease in HbA1c in 14% of the patients. There was a decrease in chances of having type 2 diabetes. There was a decrease in the body weight. There was a decrease in the cholesterol and the triglyceride levels, and lesser patients had further diagnosis of metabolic syndrome. That means at this stage, at the stage of insulin resistance, or even some patients who progress into type 2 diabetes, they reversed it. They reversed it by adopting good lifestyle therapies and good dietary modifications. So it is very, very possible to reverse this, to regress it first and then reverse it, but it requires very good amount of dedicated effort. In fact, the treatment guidelines for insulin resistance also say the first line of treatment is not pharmacotherapy. The first line of treatment is lifestyle modification. So please focus on lifestyle modification because that is the crux of treatment. In fact, there was another study which showed that there were two groups. One group was given only lifestyle modifications, while the other group was given a tablet called as metformin, which is there to decrease the blood glucose level. The group which had only lifestyle modifications reversed insulin resistance to a greater extent as compared to the group that was given metformin. So that is the power of your lifestyle, your diet, and your daily routines, your exercise, your yoga asanas. It is that important. And consistency in the same is important. You can't be like, I'll follow the lifestyle today and then next week or after 2, 3 days, I skipped one day. It doesn't work that way. Consistency is the key. I already told you that several guidelines talk about lifestyle modifications to deal with insulin resistance. And if you see several articles, including the American Journal of Lifestyle Medicine, they mention that lifestyle strategies can clearly help to reverse, to regress, and to prevent insulin resistance as well as prevent type 2 diabetes. So it is very, very, very important. So this brings us to the end of the presentation. I tried to keep it brief and simple in normal layman's language so that everybody can understand. And whether it's benefited you or not, I'm very sure, just like you can see in this image, your pancreas are definitely smiling because now they know you will recognize insulin resistance at the right time and you will be having a healthy pancreas. So thank you so much for hearing me out. I hope it did benefit everybody in some possible way. I have a few questions in the chat box, but we will now move on to a brief presentation by our head nutritionist, Dr. Shweta Tripathi. So over to you, Shweta, and then we'll take the questions.
Thank you so much, Dr. Nishtha. This was such a good insight from you. And I would like to begin from a, very good note that, that insulin resistance is reversible with lifestyle, and there is no medication per se to correct your insulin resistance. So it is only lifestyle that plays a role, and we will have to ensure that we change the lifestyle, and this is what we are here for. We will give you a complete insight into how exactly what are the things we should do to actually correct your insulin resistance. So just give me a second. I will share my screen with you all. Okay, so like how Dr. Nishtha said, about the dietary guidelines, I will share with you all. But before that, let me just share with you like what exactly is, obviously she has covered most of it, but I'll just simplify it. We all know when we eat food, specifically carbohydrates, our blood sugar level or blood glucose level goes higher. So in response to that, pancreas releases insulin. Now, in putting in a very simple language, now this insulin will go and knock on the cell's door. Now this is on, your liver, your muscles, your cells door, that let me in because I am there in the blood, increased by the carbohydrate that I have received. And I have a lot of energy and I would want to give you energy to function in a good manner throughout the day. Now, if your cells already have that energy, already they are full, they say that I don't want it. That is insulin resistance. To simplify it, what is happening is when you're eating, blood glucose is going higher now, but the body requires very less blood glucose. You had your breakfast, you had carbohydrate in that, and this is the entire process was done. Now your cells has enough energy, and after a while you snack again, you catch on to a, whatever, I would say even a fructose. So immediately after that, maybe after within an hour, you catch on to a fruit which is high in sugar. You've again given glucose and energy to your, you would want to give it to your blood. Now it is your cells are saying that I have enough. What will happen to it? Now your blood can't retain that sugar in it. So because if you have blood sugar beyond the level into your blood, it is going to turn into hyperglycemia, and this is going to impair even your brain functioning, your nervous system. So this is why where will it go? It will just go into your, into your liver, will get, so some amount of it will get restored into your liver in the form of glucose, then glycogen. Now even glycogen is full, what will happen? So then it gets stored into fat. So earlier days, what used to happen is, in winters when we were living in, in forests, we did not have all this. Our body needed a lot of fat to survive in winters. So this is why this some amount of insulin resistance was given by God. But nowadays, when we are safe and we do not need that kind of help from nature, we do not need that excess fat. So beyond the point, when this fat gets accumulated into your liver, it gets converted into fatty liver, and ultimately then higher level of triglycerides. Triglycerides are nothing but fat in blood. To simplify it into layman terms, and then so your liver is accumulating fat, your blood is having some amount of fat. So fat is everywhere because your liver says that I will convert into fat. I have enough of glucose. I have enough of glycogen. Your cells are not accepting it. So this is why, you have this insulin resistance. We can put it in two ways. However, the conclusion will be same, that your cells are refusing to take more amount of insulin. Why? They are not taking your, more amount of glucose because we don't need it. They don't need it. And then, your pancreas is sending more insulin and the entire process goes on. So what are the ways to actually correct your insulin resistance, basically? Since we've covered it all, that how exactly it happens and how does it work and what can be the symptoms, main symptoms, like how Dr. Nishtha had just told, major symptoms which I have seen in my experience, in my career, I have seen that people get a number one, dark velvety patch, very dark skin on the neck and the armpits and the groin region, and skin tags in the armpits and the groin region majorly. Also, they have a lot of craving. Even after they had their food, they have craving for food. So that is also one of the major symptoms. And sometimes even after eating food, you feel hungry. So that is also one point. Sometimes what happens, you're not even eating enough, then too you are not losing weight. So that can also be a reason behind your insulin resistance. And obviously central obesity, where you gain a lot of fat around the stomach area, that is visceral fat. Visceral fat, so there are two kinds of fats. One is there in your skin, and the other one is, into your adipose tissues, and the other one is visceral fat. Visceral fat is the fat that is around the organs, and that is the dangerous one. So in this, you gain fat into visceral area. So altogether, putting it all in all together, it is going to convert into a metabolic disorder later on if we do not address it in the beginning. So this is why, your resistance to insulin is also called as pre-diabetes, where it is giving signals. So if we listen to our body is giving signals that we have to listen to very carefully. If we are listening to our body's signal, it is telling you that, guys, enough, don't give me more glucose, don't give me more carbs, have more of, like, we've made up our mind fat is a bad guy, but actually not. If you do not have fat, how will your fat get metabolized? All of us know that liver will produce bile, and bile actually breaks down your fat. How does it breaks down your fat? There is something called as adipose, there's something called as adiponectin hormone that has to function on, your fat metabolism. So it is a whole lot of chemistry, I would say, that plays a role, biochemistry in the body, and it is all related to one to another. So if we do not, so this is the beginning. If we do not reverse it then and there, then we get into the trap of lifestyle disorders, a lot of lifestyle disorders, beginning from type 2 diabetes and then fatty liver, for females, PCOS, irregular cycles, bad acne, bad skin, bad hair. So things start turning around in a reverse manner. We would never want to be regressive. We would want to be a better version of ourselves every day. And hence we request everyone to inculcate all these practices into our lifestyle. Now, what can be the reasons? Doctor has very clearly mentioned. I wouldn't want to, take much of time on this. Acquired, there can be two reasons: acquired and genetic. Genetic can be your, type 1 diabetes, type 2 diabetes, most commonly, and PCOS. And when we talk about acquired, there can be a lot of things. Majorly nutritional imbalance is something that I would say. Glucose toxicity, which I've mentioned, keep having a lot of glucose all the time. Glucose not only in terms of sucrose, which is your sugar and fructose, but glucose is anything that is coming from your refined carbs or simple carbohydrates. Can be your wheat, can be your rice, can be your bakery products, can be biscuits, everything has glucose in it. Aging, sometimes aging also plays a role, specifically if you're not leading a active lifestyle. I'm not saying that we should stop working and we should stop resting or we should stop getting into leisure activity, watching movies, but we just have to ensure that we give that dedicated 45 minutes to our physical activity once in 24 hours, and stay a little active through the day. Like, we all of us know, just getting up after 1.5 hours, stick around in the house or whatever we need to do, and just maybe do a couple of squats and then again sit. As simple as that. So if we can be a little more active, this part can be taken care. The doctor has already covered the major symptoms, major things that you see when you have glucose intolerance, or the insulin resistance, that is increased abdominal fat. Swollen ankles is also a part of it, because your higher levels of uric acid is also sometimes related to your insulin resistance. So anyways, if your uric acid is higher, you will have swollen ankles, hunger after eating, dark skin patches, extreme thirst. That is also a sign of diabetes. However, your body is telling well in advance. When you feel thirsty all the time, or when you want to use the restroom very frequently, is your body is telling you that, please guys, look inside, I am here, and it's the right time to correct. Before we get into the trap of all of these: polycystic ovarian syndrome, type 2 diabetes, hypertension, impaired glucose tolerance. Okay, so these are the major things that I would say here, that let's reverse it at the right time. Without wasting any time, I would want you guys to take you through, dietary guidelines. So as we all know that, complex carbohydrates is something that we can take, which will provide us energy. We do not need simple carbohydrates because those are low, those are your, foods that will immediately turn into blood. These are called as high glycemic index food. As soon as you have them, your blood glucose levels goes higher. And this is the culprit. We will have to stop, let the blood glucose level go higher with our diet very soon. It has to be a slow and steady process. For that, there are a lot of things that we do. We combine our carbohydrates with fibers. That is a very good thing. It will not let your, or you can start your meal first with fiber, high fiber food. That is like before having your, maybe if you're having dal rice, before having dal rice, you may have salad. So if you have had salad, it is going to stabilize your blood sugar levels. It will not, your insulin will not spike immediately. Good protein. Okay, so protein is something that metabolizes very slow, and this is why you will see when you have a high protein diet, you're not hungry for long because it is not getting metabolized faster. The process of ingestion to digestion to absorption is actually something which is very slow. And this is why it says that, I will tell you about, guys, plating, about plating method also a little later on into our next slide. But here I would just say that having, there are studies that, if you have idli with the ghee, it might just not increase your blood sugar level if you are fond of idlis. And rather than having idlis just like that with coconut chutney, and this is why there is a concept of having it with coconut chutney, because coconut is good fat, but you add a little ghee to your idli, it is going to, that's just an example which I'm trying to tell you guys, that when you combine it with the ghee, it is not going to raise the levels of your blood glucose immediately. However, here I would mention again that please do not experiment this with your biscuits. Tea and biscuits is a very dangerous combination with a lot of people start their day with. And in the morning itself, your insulin has gone higher, and morning itself has begun, with not so good thing. If you feel if you have any of these symptoms, start your day with good fats, which can be your almonds, soaked almonds, which can be your soaked walnuts, which can be a spoon of extra virgin coconut oil, or can be A2 ghee, so that your insulin is stabilized in the morning itself. And then throughout the day, you have a healthier day. Foods that if you have any of these symptoms by now, you would have discovered, still you would just go through that what are the foods that you should not have when you think you have insulin resistance, and either ways, which is sugar, sweets, jaggery, honey, chocolates, all are simple carbohydrates. All deep fried foods, high salt food items is also a very important thing, which I'll cover a little later. Your bakery products, all of these are the foods that you should avoid if you have any of these symptoms. Now, how do we control? The most important slide and the most important part of the conversation is, if we have any of these symptoms, first thing that I've not mentioned in the slide and kept it to myself is your intermittent fasting. Keep a long gap between. I'm not talking about the people who have diabetes. Please don't do it, or else it will work otherwise for you. And this is the advice for people who do not have diabetes, who do not have to monitor their blood glucose levels. So beforehand, we are correcting it. And this is why you must have seen that people who have diabetes are advised to have fenugreek seeds. Why fenugreek seeds? Fenugreek seeds have a phytochemical compound that is called as saponins. Saponins are something that actually works on blood sugar lowering effect. These saponins stimulate insulin production and increase insulin sensitivity, which will be eventually leading to a better glucose regulation. Again, the second thing is cinnamon. Cinnamon, all of these are in our kitchen, and we are blessed to have these foods in our kitchen. Although we do not know the phytochemicals, we do not know the biochemistry of these foods and the correlation. Why is it happening in our body? But since our ancestors have told us to use us, we are using it. And this is why we are still able to manage with the, a lot of, a lot of lifestyle disorders. We are able to prevent it. However, I'm just telling you this thing that you already know. Why exactly is this doing so? So cinnamon contains a compound called as cinnamaldehyde or prostacyanidins. These are the, these are the phytocompounds or phytochemicals that actually helps in lowering your blood sugar levels and increase your insulin sensitivity. So you may use cinnamon with your tea if you are having, or you can have a concoction, or if you're making white chana or kala chana. Anyways, we have this, all of this in our garam masala, but you can start including it if you are not using it. So cinnamon is something, it's a boon to humankind. It increases your metabolism, it controls your blood sugar levels, and it also has very good effects on cancer. Probably we'll cover that in the next webinar. Now, coming to garlic, all of us use garlic in our kitchens, specifically with dals and vegetables and all of it. So I would say garlic contains, your allicin, alanine, and your allyl propyl disulfide. These are the compounds that play a very important role in your blood glucose metabolism. So is curcumin. All of us use this, turmeric at home. And this is what have been advised from our elders, that we use curcumin, we use turmeric in our food on day-to-day basis. It reduces the inflammation and oxidative stress in the body. Probably in my next, webinar, I will cover what is oxidative stress and what exactly inflammation is. Inflammation is a very commonly used word, but what exactly inflammation is? Is it just the swelling on the body, or it is something more than that? We'll discuss this in the coming webinars. Now, coming to ginger. Ginger, all of us add ginger to our food, all of us add ginger to our teas or to our concoctions, to our cold, the cold drinks that we create at home with the lemon and ginger and pink salt and all of it. Why ginger? So ginger also contains several bioactive compounds. Some of them are your gingerols, chagols, and zingerones. These also contribute to actually regulate your glucose and lipid metabolism, along with the controlling your blood sugar levels. So these are the foods which actually can help you improve your insulin sensitivity if you have any of these symptoms. Now, what else can help in reducing or taking charge of insulin sensitivity if you have? It is the exercise. Exercise makes your body deprived of glucose, and this is when the cell says that I need glucose, I need more energy. And this is when your this is when your insulin will knock knock, and your cell will open the door, and your blood sugar will go inside. It is, I think it is simplified enough to understand that why is insulin important and why is insulin sensitivity important. So let's stop blaming insulin for not creating sensitivity for itself. This is us who are not letting it happen by consuming and galloping carbohydrates all the time. On an Indian family, in an average Indian family, each meal of ours has about 1400 to 1500 calories only from carbohydrate. In the morning, we eat poha. In the lunch, we eat roti, sabzi, dal, chawal, pasta, pizza, or whatever, and then burgers. And towards the dinner, again, we have some preparations made of rice and made of. So these are not culprits, but we just have to ensure that we make a perfect combination, combine them with good fats and good amount of soluble and insoluble fibers, so that there is no insulin spike immediately. So this is all in the lifestyle. Intermittent fasting is one of the best ways when your cells go hungry and they crave for, they ask for, they demand for glucose, and hence the insulin sensitivity can be reversed. So I would suggest all of you to not keep snacking in between your meals. Have large meals. Even if you are snacking on in between your meals, it has to be something that will not increase your insulin levels immediately, glucose levels immediately. There are foods which do not increase your blood sugar levels immediately after eating. If you join our program, we'll give you complete understanding of what are these foods and what should be the permutation combinations when we eat, and how exactly are we supposed to eat are all the foods. It's not that we eating a lot. It is just that we are not making the right permutation combination, the right time, and the right ways to eat it. We ideally we should have the smallest portion. So there should be two vegetables. One has to be green and one has to be multicolored. Along with that, your protein can be paneer. Protein can be your chicken. It can be your poultry items like egg and so on. Protein can be your dals, your legumes. However, your legumes have good amount of complex carbohydrates. So if you're skipping on your rice and rotis, trust me, if you have any symptoms and you start skipping on your rice and rotis and have more of lentils and legumes and vegetables in your diet, you wouldn't even need a doctor ever in your life. And this is what we are on a mission on that. Although we have a doctor who believes in lifestyle, but it is very simple for the doctor to inculcate pills and medicines into your lifestyle. However, it is our responsibility to correct all of it through lifestyle and not get into that trap, because all the allopathic medicines have side effects. And this is pretty much it from my end. If anybody has any questions, like how Dr. Nishtha said in the beginning, please do let us know. We'll be very happy to answer your questions.
Yeah, Shweta, I think there are a few questions in the chat box. We can start picking up the questions. So shall we take the questions, Shweta? Initial ones I think came during my PPT, and then eventually I'll hand it over to you.
Please.
Yep.
Sure.
Yes. So there is a question: when should we start looking for these symptoms? So like I mentioned to you, in case there is any risk factor, if there is any genetic component, anybody in your close family, first degree relatives has diabetes, has a history of hormonal imbalance, or has a history of insulin resistance, be watchful. Not only such people, but in fact, I feel everybody should be vigilant enough to understand these symptoms. Now you're already aware about the symptoms. Check out if you have obesity. Check out if you have deranged cholesterol levels, because getting into the root cause is very important. So, for example, if your cholesterol levels are deranged, your doctor will immediately add statins. That will bring your cholesterol normal to the normal levels. But within you, there is something else that's happening. That's insulin resistance. Symptoms are in control, but the resistance, insulin resistance, the root cause has not been taken care of. So please be mindful about everything that you do. And I believe everybody should be watchful equally for their symptoms. In fact, the watchfulness should decrease more once you cross the age of 30, because IR insulin resistance is more common as we advance into elderly age group, and the hormonal imbalance also starts more commonly 30 years onwards. So 30 years onwards, please be more watchful. That was the first question. The second question is from Vandana. She says, hi doc, I have a question for this condition. Can we reverse this condition? The answer to this is yes. You can reverse this condition, but not everybody can. Okay, so that requires a lot of dedicated efforts in terms of your lifestyle changes. May I request everybody to mute themselves? Yeah. You require dedicated efforts. So the idea here would be first to regress your symptoms, to decrease your symptoms, and then eventually and gradually you will be able to reverse it, because there are clinical studies, there are case reports which have shown that insulin resistance has been reversed, and we've seen that in our practice as well.
Yes.
Yeah, the next question is, may I request everybody to mute themselves, because there is some disturbance in the background. Thank you. Okay, the next question is, I would like to know whether it is more common in males or females. So I would say, males have more tendency to develop visceral fat in the abdomen, because females have estrogen, which has certain protective effects. So therefore, in the initial years, males have more preponderance. But once females attain the age of menopause, that time there's an equal, frequency of having insulin resistance, be it males or females. But before the age of menopause, females have some protection in the form of estrogen. Therefore, it's more in males in that case. The next question is from Ganesh. What advice do you have for individuals who may be struggling with insulin resistance and how they can control their health? So, like myself and Shweta, we kept on stressing on lifestyle. Your physical activity, 30 to 45 minutes of physical activity every day. Good balanced nutrition, good balanced diet, like Shweta mentioned in her presentation. Yogasanas and exercise, because especially some of the yogasanas help in abdominal compression and help to stimulate the pancreas and help in the proper functioning. Similarly, exercise helps in good blood circulation and helps your pancreas active in the right way, helps your organs active in the right way, helps to reduce your abdominal fat as well. So all these are going to be very helpful. And of course, understand the trigger factor, whether it is genetic, whether it is due to your obesity, what exactly is the trigger factor, whether sometimes even stress can be a trigger factor for insulin resistance. So identify the trigger factor and pay heed to it. So if stress is a trigger factor, you might require some health coaching. And therefore, when we talk of our program, it has an amalgamation of everything. We have a medical team, we have a team of nutritionists, we have yoga therapists, as well as we have people who can help with mental health coaching. So it's an amalgamation, a 360-degree approach to all of this, which takes care of insulin resistance. Okay, the next question is from Divya. Hi, Doc. Can you share some common misconceptions about insulin resistance and how they can be corrected? So the most common misconception that people have is every case of diabetes is related to insulin resistance. It's not always the case. So type 2 diabetes, in type 2 diabetes mellitus, majority of the patients will have insulin resistance, but not every patient. While in type 1 diabetes, insulin resistance is not the major thing. In type 1 diabetes, there is a problem in the pancreas itself, and therefore they are not producing insulin itself. So this is a very common misconception, but yes, type 2 DM, type 2 diabetes patients, majority of them will be having insulin resistance. So that was an important misconception. And along with that, there are some patients who think that maybe I just have an increased cholesterol, increased triglycerides. That doesn't mean I have insulin resistance. And there are other extremes of patients who think that even if they have one symptom, they have insulin resistance. So you need to mindfully think. There might be patients who have cholesterol issues, could be linked to the root cause as insulin resistance, but not always the case. Not always the case. Hair loss could be linked to your insulin resistance, but not always the case. It can be related to several other vitamin deficiencies or abnormalities in the body. So therefore, one must not overthink also, and one must not take it too lightly also, that I don't have all the symptoms. So why should I bother now? Let me wait till it progresses. Then we'll go to the doctor. It doesn't work that way. The third misconception is that of the use of medication. So everybody thinks that only medications can get their glucose levels right. Only metformin or anti-diabetic medications can get their glucose levels right. So that's not true, because like I told you even in a presentation, clinical studies have shown that lifestyle alone can correct your insulin and glucose levels. So these three were the common misconceptions. The next question by Samantha. Hi, ma'am. Is insulin resistance present in every case of diabetes? I already covered that in one of the previous overlapping questions. In majority of the type 2 diabetes cases, it is present, but not in every case it's present. And in type 1 diabetes, it is rarely present. So that's about it. Then the next question by Divya. Hi, is there any blood work to diagnose insulin resistance? Yes. So you can have blood tests in the form of fasting insulin levels, fasting glucose levels. Then there is something called as HOMA, which is homeostatic assessment for insulin resistance. So there is a specific formula that is used to calculate what should be the appropriate insulin and glucose levels If both together are deranged, the fraction is deranged, that is the time there would be an accurate diagnosis of insulin resistance. I request that you please meet your healthcare specialist before yourself self-diagnosing into it. Yes, and I think the next other questions, Shweta, are related to nutrition. If you would want to take that over.
Yes. So the next question says, hi, ma'am, can we take honey during diabetes? I wouldn't suggest that, because honey is ultimately your dextrose, and dextrose will also convert into simple sugars and will increase blood glucose levels. So any form of sugar, be it jaggery, be it honey, or be it your white sugar, brown sugar, all of these are ultimately forms of sugars. So I wouldn't recommend anybody to take honey during their diabetes, if they are having diabetes. And the next question says, hi, if I join your program, how are you going to reverse this condition? You will advise allopathy medication. Okay, so since we have doctors and lifestyle experts and myself and the team of expert nutritionists, clinical nutritionists, diabetologists, and all of those in the team, we will first analyze everything, whether the medication is required, not required. Can we take charge of your health condition only with lifestyle management? Obviously, we will not. We are not good supporters of medication. Even the Dr. Nishtha, who's who's MBBS MD allopathy practitioner, but she's also not a big advocate of giving medication. We try and correct maximum things through diet and lifestyle. And trust you me, everything lies in your diet and lifestyle. Medication only shows it good on the blood work reports. It doesn't, you stop taking medication, it is gonna eventually turn out to be the same. So the only thing that can reverse the condition is your lifestyle, and that's what we master at, and that's what we all have experienced. I mean, like I have experienced in my last 15 years of career, because this is the only thing that can correct your, or reverse your lifestyle disorder. I think this is pretty much it. We have taken all the question and answers. Anything else beyond that, please check our Instagram profile. In case you want, we'll share it with you separately, our Instagram profile, where me and Dr. Nishtha keep talking about these lifestyle disorders. Off and on their videos, off and on their static content and everything. Or you may, contact us for one-on-one consult. That is also available, post which you can decide whether you would want to, join the program or not. Everything is available here. Please do connect with us at, our Instagram profile, DM us, or you may check our website. I mean, we are there everywhere to help you guys. I think this is pretty much it from our end. We will see you really soon with yet another common problem, common topic of health disorders. And hope to see you soon. I hope it was a fruitful and a good, piece of information for all of you. However, please do not self-diagnose yourself. Don't get too serious about it. Do let us know. We'll help you that whether you need all these blood tests, whether you have any anything related to it, we will guide you even for a free consult sometimes that we run on. There are times when we announce a free consult. So those are also the opportunities for people to get benefited out of our program. Do let us know and DM us on our Instagram profile.
Sure.
Okay. Thank you so much, everyone. Hope to see you all soon. Bye-bye.
Thank you. Bye, everyone. Take care. Stay healthy.
Bye.
Stay safe. Bye.
Thank you very much.